zone. So health officials in Fairfax County now warning parents as pneumonia cases among children approach record levels. The surge, which began in the spring and peaked in October, continues to show no signs of slowing, raising concerns as cold and flu season ramps up. Would you believe children between the ages of 2 and 17 are being hit the hardest? In Fairfax County alone, nearly 5% of all emergency room and urgent care visits from November the 10th through the 16th were pretty much attributed to pneumonia. Joining us now to discuss all things surrounding that is Dr. David Shaker from the Shaker Medical Group, kind enough to join us right here on the Live Zone. Dr. Shaker, good to see you, sir. Welcome to the show.
Well, thanks, Guy. I appreciate you.
Appreciate you being patient, sir. Obviously, this is concerning a lot of parents. They're saying, hey, wait a minute, hold up, what's going on here? I'm hoping you could, let's say, bring some calm to a lot of folks that are really on the edge of their seat right now. Well, why are we seeing this spike, and what is it that parents can do to prevent their children from actually going down the same road?
Okay, good. So let's bring some of these numbers to life a little bit first. So the Department of Health said that in November, about 100, if about 100 cases came into the ER urgent care, 5 of them were diagnosed with pneumonia. And that's a much higher rate than typical. 10% of those are 5 to 17-year-olds, and 12% of those visits are going to be 2 to 4-year-olds. So you're actually getting it more commonly in the younger patients. As far as preventing it, the main thing for prevention, I'll always say, is going to be hand washing. This is one of those ounce of prevention, goes a lot further than any sort of attempt at care. The second thing has to be vaccinations, flu vaccines. They could do RSV vaccines now. For the older population, there's pneumonia vaccines. All of the regular year-to-year vaccines you want to make sure people are up to date on.
Yeah, gosh, I mean, just to think that this is happening. And so I guess what we're saying is that although the focus right now is on Fairfax County, this can pretty much happen any and everywhere. Is that correct?
This can happen any and everywhere, and the spread can happen to anyone. So we're talking about it as an elevation spike among young people or young kids. At the same time, you could be going home to an older loved one, and they can contract a lot of these pneumonias too. Typically, what's being seen now is what's called mycoplasma pneumonia, or it's an atypical pneumonia. With atypical pneumonias, they're a little bit harder to treat. You can't use the typical penicillins, amoxicillins, things like that. You've got to use what's called a macrolide, which typically people know as azithromycin.
Okay, so we made mention of parents. What about teachers? Because we know that these kids are going to this place called school each and every day where they're surrounded by other kids. Is there certain things that teachers should be doing in order to make sure that these kids stay safe?
Let's talk about the parents. I always implore parents, if your child is sick, keep them home from school. I know it's difficult when it comes to work and responsibilities, but keep your sick child home at school. Don't give them a dose of Tylenol or Advil just to bring the temperature down and then send them off. That's the best thing that we can all do for our teachers. As far as in class, frequent hand washing, encouraging a child to get up and wash their hands after sneezing, that can prevent the propagation to the teachers and to everyone else. When it comes to just the teachers specifically, they should be seeing their primary care physician regularly. They should make sure that their asthma, their allergies, their emphysema is all under control if they have any. And please, anytime you're talking about the lungs or the upper respiratory system, you want to decrease and reduce smoking as much as possible. Even an acute change or just a reduction in the short term can make a significant effect on how a virus or bacterial infection can affect you.
Yeah, I know we're talking about pneumonia, but as you heard me make mention in the intro, we are also concerned about the cold and flu. Yes, flu season ramping up in a major way. Any different precautions one should take because of, well, let's say that happens to be different from the pneumonia?
So it's about the same. You want to make sure that people are getting flu vaccinated. A lot of parents tell me that they don't want to vaccinate their kids. I think there's an understanding to that. They're worried about them. There is some sort of misinformation out there in the system, but at the very least, you can get vaccinated, right? That's an important one. The other thing is, too, I always worry about when there's a large spike of these type of infections, that something else gets missed. I know that you were on with Dr. Merholm recently, and you were discussing vaccination for measles. MMR, measles, mumps, rubella, just getting those general vaccinations for kids is very, very important to prevent the propagation of any of these preventable infections.
All right, so let's cover the entire gambit and we'll end with this, and that is COVID. Obviously something that a lot of folks seem to overlook it nowadays, but it's still something that's very, well, it affects a lot of folks right now in America.
So COVID, again, still a virus here. You can always get the COVID vaccine. There was a new one with a booster out. It's always recommended for anyone who might be already ill in terms of immunocompromised, things like that. Talk to your doctor about getting them. There's significant accessibility. There's different types. There's really no excuse. And we have a lot of access to care in our country. We need to make sure that we're utilizing it. We have a lot of access to doctors. We need to make sure that we're utilizing them. We have access to good information and misinformation. And I think essentially that's what your primary care physician is for. They should be shedding light on what's important, what you can do, what you shouldn't do, and help make shared decision making between you, your family members, and loved ones.
Well, I got to tell you, because of you, a lot of parents have a little bit more peace of mind. Once again, Dr.
I
David
hope
Shaker
that's the case.
with the Shaker Medical Group, yet again kind enough to join us right here on the Live Zone. Truly appreciate you, sir.
Anytime. Appreciate it.